Can Ca-19 levels indicate borderline resectable pancreatic cancer? Have you ever wondered how certain tests can help in diagnosing pancreatic cancer? One such test measures a substance called Ca-19. This tumor marker is often discussed in the context of pancreatic cancer management. However, can it really tell us if a pancreatic tumor is borderline resectable? Let's explore this together. Ca-19 is a protein that pancreatic cancer cells produce. Doctors can measure its levels in the blood. Generally, elevated Ca-19 levels can suggest the presence of pancreatic cancer and may indicate how much tumor burden is present. However, it is important to note that normal levels of Ca-19 do not rule out cancer. Some individuals may not produce this marker due to genetic reasons. Additionally, Ca-19 can be elevated in other types of cancers and even in benign conditions, which limits its specificity. When it comes to borderline resectable pancreatic cancer, this term refers to tumors that are close to major blood vessels. These tumors are challenging to remove surgically but may still be operable with advanced techniques. While Ca-19 levels can provide some supportive information, they are not enough on their own to determine if a tumor is borderline resectable. In clinical practice, Ca-19 is primarily used to assist in diagnosing pancreatic cancer when it is suspected. It also helps monitor how well treatment is working and can indicate if the cancer has returned after treatment. If Ca-19 levels rise, it may suggest that the tumor is growing or progressing. Conversely, if the levels decrease, it could indicate that the treatment is effective. However, Ca-19 is not reliable for screening people who do not show symptoms or for detailed staging, such as assessing borderline resectability. To accurately determine borderline resectability, doctors relying on imaging studies like computed tomography scans or magnetic resonance imaging. These imaging techniques evaluate how the tumor interacts with nearby blood vessels. While Ca-19 levels may be elevated in cases of borderline resectable cancer, they do not specifically define this condition. Instead, they can help guide clinical decisions when used alongside imaging and biopsy results. In summary, while Ca-19 levels can provide valuable insights into pancreatic cancer presence and treatment response, they do not specifically indicate whether a tumor is borderline resectable. The assessment of resectability relies on imaging studies and a comprehensive evaluation by a team of medical professionals. Always consult with healthcare providers for personalized medical advice and to understand what the results mean for individual circumstances.